Ketogenic diet, I've seen it work in bipolar disorder and schizophrenia and severe major depression and severe OCD, but it's not necessarily what everyone needs. It can just, improve their metabolic health and start improving their mental health with some of these smaller steps.
And it is a treatment that falls into the category of disease modification rather than just addressing symptoms, which unfortunately the vast majority of our medication options seem to be more tailored towards addressing symptoms. I'm
I would say
curious.
that even stronger, 100%. They're only about addressing symptoms.
Or, put more simply,
If you need help like this guy, call your own doctor.
I was listening to a psychiatrist, and I can't remember her name right now, but she's in the same metabolic psychiatry realm. She pointed out something that's so obvious about even naturally occurring sugars. She said it's not normal to dump all the sugar from a fruit into one drink and then guzzle it down.
Right.
That's a large sugar intake, and we evolutionarily are not used to getting that much sugar in that short amount of time. But it does make me wonder, because my toddlers love fruit, and sometimes it feels like one of the only healthy things that we can get them to eat. Is there a difference between naturally occurring sugars, not naturally occurring put into an unnatural amount, versus something like the added sugars that you see in feels like 80% of yogurts on the aisle at Kroger or Meijer or whatever grocery you go to?
There's a huge difference. And the way to think about that is, let's say you eat, a cup of strawberries. That has a certain amount of fructose in it. But that sugar isn't going to be absorbed by our gut immediately, because the sugars are all wrapped around in fiber that are in the fruit as well. And so that's going to get digested very slowly, and our body can handle that. Now, some of the higher sugar fruits, we have to be a little more careful of. So tropical fruits, mangoes, pineapples, bananas, that gives you a little more of a straight shot of sugar. But that's very, very different than having a soda that is pure sugar immediately absorbed. There's no fiber whatsoever, of course, right? And so that's going to give a huge spike of glucose. And, for people to learn about this, if they're interested, one of the most illuminating things that someone can do is wear a continuous glucose monitor, which are now over the counter. You don't need a doctor's prescription. You can buy one. I think they're about $50, and they last for 2 weeks, and you sync it up with your phone. So it's a little bit of an expense, but it's a huge amount of learning for your $50. And you get a glucose reading every 5 minutes. And you can see exactly, based on what you're eating, what is spiking your glucose up above 130. Anything that spikes your glucose up above 130 that you ate is a problem. And then you can see also how quickly is your body going to bring that glucose back down. And also, how do you feel when your glucose is 130 versus how do you feel 2 hours later when your glucose rebounds down because of an insulin spike down to 70, and it's dropping and you feel much worse. That's part of what causes mental health conditions, what causes anxiety problems, mood problems. People think it's all what they're thinking and what's going on in the mind, but it's also what's going on in their biology and in their fuel state. It's an incredible learning experience to do. So I advise anyone who's interested to try that out.
That is certainly a powerful message in terms of biofeedback for the patient.
Yeah.
You can have all the knowledge in the world about how well this works, the fact that it works, the fact that it's safe. But if you can't communicate that to your patient, it doesn't matter.
That's absolutely right. Yeah.
And people's minds or their subconscious, they crave something that they can see right after a behavior.
Yes.
That reflects that, post hoc ergo propter hoc type of fallacy,
Right.
or potential fallacy. Does a typical ketogenic diet, does it typically include fasting?
It doesn't have to at all. I mean, people can eat 3 meals a day and be in ketosis as long as the macronutrients are the right way. Like I said, high fat, moderate protein, very low carbohydrate. Fasting can sometimes boost ketones. So some people are having trouble getting their ketones up, or if they want to make more progress, especially if someone wants to lose weight on their ketogenic diet, sometimes some fasting in the mix can really accelerate all of that. And fasting is very good for resensitizing cells to insulin as well. When I first learned about fasting, I thought, oh, I can't do that. I was very insulin resistant at the time. This is about, I don't know, maybe 6 years ago. I used to have to eat 6 times a day to keep my brain going. I learned about fasting. I said, I'll never be able to do that. But once you actually teach your body how to do it, and your body learns how to burn fat and make ketones, it actually becomes so easy. And now I can skip meals without a problem. It doesn't make any difference. I can function just as well because I can always pull fat out of storage. That's what our fat storage is there for. Pull it out of storage, burn it as fatty acids in the muscle, and turn it into ketones for my brain, and I feel just fine.
I'd like to think that continues the cycle of store fat and retrieve fat going, so you don't have, the same substance sitting in your body for years or even decades, because you have this constant overturning and you're not always just storing more fat and glucose.
Right.
I am curious, what is maybe the least stringent study or dietary restriction within ketogenesis that you're aware of that has also revealed pretty promising results?
I mean, I can talk about experience with patients because I've been doing this for years now. And there are people who don't want to do a ketogenic diet, but we make less intensive changes and we can get some really, really powerful benefits. So, I mean, number one is let's try to get some of the ultra processed food out of the diet, get rid of the sugar, get rid of, things that are shelf stable in the grocery store for 3 or 4 years are probably not things that we want to be eating. Maybe if it's canned and it's a vegetable, might be okay. But anything in a box or a bag and a barcode and sitting in a store, get rid of the processed sugar. That can be a great first step. See if I can get someone exercising at that point. Even if they're doing nothing, just get them walking. The next step after that might be to try out a little bit of intermittent fasting or time-restricted eating. Can I get someone to skip breakfast? One of the tricks is there's this stuff called MCT oil. I don't know if you've heard of that. It stands for medium chain triglyceride oil. And it's a derivative of coconut oil. And that oil goes immediately into the gut, through the portal vein to the liver, and the liver sees it. And as long as insulin isn't high, so if you're in a fasted state, the liver will convert the MCT almost completely into ketones. So you can get a little boost of ketones if you have some MCT oil in the morning, maybe in some coffee. There's a drink called a bulletproof coffee that people might have heard of. It's basically butter and MCT oil, or you can use heavy cream and MCT oil in coffee, and you have that instead of breakfast. Most people who I've asked to do that come back and say, wow, what was that? That was amazing. I felt like that wasn't just coffee. Like I felt great because they made some ketones. They started feeling what ketones are like in their brain. And the thing about ketones is they take hunger away. And so you're not hungry. Your body's kind of primed to start burning some fat at that point. And you're sort of teaching your body to be metabolically flexible, to use fat as fuel again if it had become insulin resistant. And so that's a great approach as a start. And I think for a lot of people who maybe have some ADHD, attentional issues, some mild depression, some anxiety, that may be all they need to do. They don't necessarily need to go all the way to a ketogenic diet. I think that ketogenic diet I've seen it work in, bipolar disorder and schizophrenia and severe major depression and severe OCD, but it's not necessarily what everyone needs. It can just, improve their metabolic health and start improving their mental health with some of these smaller steps.
And it is a treatment that falls into the category of disease modification rather than just addressing symptoms, which unfortunately the vast majority of our medication options seem to be more tailored towards addressing symptoms. I'm curious.
I would say that even stronger, 100%. They're only about addressing symptoms. I mean,
Yeah.
None of our treatments are truly disease modifying.
I would argue on lithium with that one.
Well,
But
okay.
but you could argue that that's not necessarily a medicine because it's not a synthetically created substance, right?
Yeah, I'll concede that one.
Because some of the ways that changes our genetic expression are really, I mean, it's remarkable to me. I probably wouldn't be doing this already at this point if I hadn't broken out of that fear of lithium
Yeah.
that was taught to me in my training and started to use a significantly greater amount of it. But yes, we're nearly in wholehearted agreement on that.
Yeah, and in terms of the disease modifying part of this, let me just talk about that for a second. So this is mostly known in, kids who have epilepsy, which you had mentioned before. Ketogenic diet has, at least 13 or 14 randomized trials for epilepsy, kids and adults, and it works when medications don't work. So there's 2 Cochrane reviews showing that it works in drug-resistant epilepsy for kids. With the kids where it works the best, they're able to get off all their anti-seizure medications. They have great seizure control. They can be on the ketogenic diet for usually somewhere between 2 to 5 years. They can come off the ketogenic diet and their seizures never come back. Talk about
That's
disease
impressive.
modifying.
Yeah.
What other brain illness do we see any treatment make it go away? I mean,
Now, will their disease come back if they dive right back into really bad dietary habits for an extended period of time?
potentially, yeah, potentially so. I mean, it's not as if, it's a permanent cure and you're safe forever, but if they stay on a reasonable diet, they don't have to be in a ketogenic diet anymore, and their seizures remain, gone, which, we just can't say that about other treatments for brain disorders. So it's pretty exciting.
Yeah, we don't know what causes our illnesses in psychiatry. If we did know, they would be neurologic conditions, right? And the neurologists would manage them. But I'm curious because this was not your typical clinical practice or philosophy for the better part of a decade or longer in your practice. What would you estimate the difference in terms of orders of magnitude you've had in terms of results or outcomes with your patients using primarily dietary change versus medications in the past?
It's a huge difference because, it's very rare. And, and I've treated thousands and thousands of patients in my, it's almost 25 years now that I've been practicing as a full-time clinician. And it's incredibly, I can count on, probably 2 hands, the people where I felt like the medication got them their lives back. It just doesn't happen, right? We can reduce symptoms with medications, and I do that all the time. But then there's a whole other set of problems. There's side effects. There's metabolic issues. There's sedation. And then even with the best of psychotherapies and psychosocial supports, with severe illness, we just don't see people that often get back to their full level of functioning with medication treatments. Whereas with these ketogenic diets, when people do well, you just start to see people blossoming. I mean, they literally they have the energy, they've got the focus, their symptoms are reduced, we start reducing medications. It's a whole different picture. People do get back to their lives when it's working, and we can get them to do it. And the other thing I like to say is that it's the only treatment I've ever had in my hands where if people actually do the treatment, it's universally beneficial. I have never seen someone in ketosis not experience mental health benefits. And I can't say that about any other treatment I've had in my hands.
Absolutely. Sounds like one of the more promising treatments out there and speaks to what you've discussed, what I adhere to, that high benefit to risk ratio. Drives me a little crazy that more people are not willing to try it because the risk is so low. You've referenced one of the bigger studies on the ketogenic diet or ketosis is this case series of 31 French patients.
Yeah.
Can you tell us more about that?
Yeah, so just briefly, this is an experienced psychiatrist in France. He worked in hospital settings, and he had a nephew who he convinced his family to put on a ketogenic diet. The nephew had, I think, autism and some seizures. Maybe it was just autism. I can't remember exactly. But anyway, his nephew had this tremendous benefit. And he knew about the literature, the case reports at that time on psychosis. And he thought, well, I'm going to try to convince people on my inpatient unit to do a ketogenic diet. So he did a very informal intervention. He put a series of 31 people who agreed to do it on a ketogenic diet. These are people with schizophrenia, major depression, and bipolar disorder, who had all been hospitalized multiple times, who had chronic illness, all on multiple medications. Many of them had metabolic syndrome. sort of a typical inpatient that we often see in America, right?
And
Except
he
the
was
difference.
able to provide the entirety of the diet because they were inpatient, right?
Exactly. He was able to provide the entirety of the diet. He didn't even measure ketone in that study, interestingly enough, which we, would recommend to do. But, it was pretty, just rough and ready. Like, we're just going to do the diet and see what happens. And he had incredible results. The effect size is, the 3 or like
Oh,
3.2
wow.
for, the HAM-D, the MADRS, the
Just to
PAN.
give people a comparison
Yeah,
here, SSRI antidepressants typically have an effect size ranging zero point 0.3 at the very most zero point 0.5.
correct. Right.
So you're talking about a 10 times more effective
Yeah.
treatment for depression than the first line agent for depression that we are taught to prescribe right off the bat without question.
Now, I mean, you can criticize this study from a scientific perspective, didn't have a control group. There are potential other sources of bias in that study. Nonetheless, when you see those kind of results, and especially when you see them with your own eyes, which, now I have multiple times, you can't not be excited about the power of this intervention to reduce severe symptoms of severe illnesses where, I know for a fact the medications that I've been using for that same person just have not worked. So in that study, he also got people on much lower doses of medications. So these are inpatients who discharged on less medication than they came in on. They had metabolic improvements as well. They lost weight, better blood pressure, better lab work. I mean, this is what I see all the time in my practice and at my program. I now have this program that you mentioned, Accord, where we do immersive treatments. It's not inpatient. We don't have a locked door. It's just a place where people can get immersed into this treatment all at once if they want to really do all of these metabolic changes all at one time and learn how to do it and be able to then sustain it when they get home.
Is Accord a private pay or
It
do you take
is.
insurance?
It's
And
private pay.
do you
Yeah.
take patients from anywhere?
We do. We take them from all over the country. We've had people come from other countries as well. We do have the ability to offer some scholarships. It is unfortunately, it's expensive because it's a small program. We have a good amount of staff and I think we do a good job. But for people who can't afford it, and we do try to reduce the cost. Yeah.
I knew I was coming on here today and I had a patient, severe bipolar, started a GLP-1 and 2 months in has severe gastroparesis, vomiting multiple times a day, always been euphoric and elevated, but now it's more irritable and anxious, laying in bed for 8 hours at night, but waking up, regularly. Maybe we try.
I do occasionally use GLP-1 medications for people, but just low dose, just so they can transition into the diet. Because you had asked this before, and I don't think I ever answered it. Some people are very addicted to sugar, and for some people, it's just psychologically embedded that they need these, sugary foods. And for those people, a little bit of a GLP-1 can sometimes help them transition into the healthy diet, start exercising, and then the goal is get them off that GLP-1 within, 3 to 9 months at the most. And I never go up to the full high dose either.
I was going to say, I could tell you about a half dozen experiences, a couple with my patients, but a couple of really concerning ones processing one-time evaluations for guardianship, where I had a guy who had a severe thiamine deficiency that led to Wernicke-Korsakoff,
Oh, wow.
who was fully functioning. He was just trying to lose weight for a hernia surgery.
Mm.
He died before I could even do the evaluation. So
Oh, wow.
I'm not saying there's not utilization for the GLP-1s. They've been life-changing for a lot of people. But again, I think it speaks to the fact that we overuse medications here that.
So back to risk benefit. I mean, those can have tremendous benefits. They have very significant risks as well, especially at the full high weight loss dose, especially over longer periods of time. Nutritional deficiencies become very common on those medications, unless someone's really paying attention to diet and exercise, and the goal being to get off the medication.
Right. So I am curious because Finland has a nice program for severe mental illness called Open Dialogue.
Oh, yeah.
It does not, to my knowledge, involve dietary restriction or change, but instead, they try to meet people in crisis within 24 hours, immerse them in treatment, surround them with social support. They've been able to show a huge reduction in the need for antipsychotics for the severely mentally ill, it makes me wonder how much of the effect for the ketogenic diet may be related to social support versus the diet itself. And what would you make of Finland's approach to severe mental illness and how that may, it just seems like it could confound. I'm not saying it does.
Yeah.
I'm just curious to
I
hear your
think
take on it.
I'm glad you asked, actually. Yeah. So interestingly enough, I was trained in open dialogue about 8 years ago in my program, Ellenhorn. We were one of the first programs in America that got trained in open dialogue, and I've been doing it in my practice, since then. And it's a wonderful type of therapy, and I have seen it be very effective to get people talking, to get people opening up. I have not ever seen it, melt psychosis away the way ketones do. And what I would say is that it's differently practiced in Finland. When they do it, they're a community, a tight community. They have a system where they can actually do open dialogue meetings daily while someone's in crisis. So could you imagine a team of clinicians, person has a new onset of psychosis, you get a team of 3 clinicians come to the home every day for 2 hours to do a big meeting with them and the family. Like, we just could not reproduce that here. So when we do open dialogue here, we do it once a week. It's not the main, centerpiece of treatment. It's very hard to recreate what they do in Finland. And what I would say is that, we do see a real relationship between ketone levels and improvements. I take the point that some of what people are getting could be, not just biologic. It could be because of the support they're getting, the energy towards this new treatment, this idea that ketones are going to help me. No question, there can be some of that that's partly, producing some of the benefits, but I'm pretty sure most of it is from the biology.
Yeah, and I mean there is certainly good science and mechanism of action that backs up the outcome results, which the public, all they care about really is the outcome, right?
Right.
The scientists care about the science behind it and being able to connect the dots. But last couple of questions here: what kind of modified forms might this treatment take? Like, if I just fast 16 hours a day, and then for the other 8 hours a day, I eat whatever I want. I eat processed food. I eat added sugar, all the tasty stuff. Will this induce ketosis? Similar results to a more stringent or strict ketogenic diet with or without fasting?
No, I mean, you won't make ketones if you did that. You would maybe get a little bit of benefit because you're eating in a shorter window of time. So you might get some metabolic benefits. You might improve your insulin resistance a little bit. I would say if you could fast for 16 hours and then during the 8 hours eat a healthy, what we call low glycemic index diet, where you're not eating simple sugars and processed carbohydrates and processed food, whole foods that are not likely to spike glucose, you would get a lot of benefits from that. Fasting plus low glycemic index, you can get tremendous benefits. It might be not quite as fast as a ketogenic diet, and you won't make as high level of ketones. But if you're eating processed foods for those 8 hours, a little bit of benefit from fasting, but not in terms of brain health benefits, not much. Yeah.
It seems like a very promising treatment, especially for patients with means.
Yeah.
But with a widening income gap in America, I think it's important to address that elephant in the room. Can we implement this in low income and poor food choice areas of the country?
Yeah.
And if so, in what kind of modified way?
Yeah, this is a great question. People ask this a lot, and I think there's a lot of assumptions that are made about this being expensive. And I just said, my program is expensive, and it is. But I can tell you about another program, not for mental health, but for diabetes, so type 2 diabetes. There's a program called OWNA Health, OWNA, and the endocrinologist who runs that, Mariella Glant, has done a pilot study in the South Bronx with people who are very low income, many of them on food stamps, difficult psychosocial circumstances, many people working multiple jobs to try to survive. And these people, she started with a hemoglobin A1C average of like 9.9, and she has an app essentially where she gets people to do a ketogenic diet through an app. And she dropped their hemoglobin A1C, I think it was down to like 7.1.
Which is an
3
average
months.
glucose, what is it, 10%? Is that
It's
close
really
to 300?
high. And she got people off their diabetes medications. She showed significant benefits in depression and anxiety on the PHQ-9 and the GAD-7 in that same study. She has people just going to the grocery store. You don't need to buy expensive food to do a ketogenic diet. You just need high fat, moderate protein, low carbohydrates. And in fact, you can get some, high fat ground beef and some peppers and some onions, and you've got dinner, right? Costs almost, literally a few bucks to feed, a few people. And similarly, you can have eggs for breakfast and, cooked in butter, and you're in ketosis. You don't need fancy products to be in ketosis. And she doesn't even measure ketones. She starts them on it and she takes them off their insulin almost immediately because they don't need it anymore once they're not eating the carbohydrates. And so that goes to show that this is scalable and doable for everyone. If we had the right information and the right motivations, that's really what it comes down to. I hope that leaves people with a little bit of a more hopeful thought about this, that it's not just a fancy thing for people with means. It can be, for anybody. It's really about, throw away the bags and the boxes of food and go out and get, real meat and vegetables, and you can be in ketosis.
Yeah, absolutely. Well, hopefully the MAHA movement will follow through on some of the things that they've been most passionate about in terms of removing banned substances that are banned in other countries from our food supply and reformulating that food pyramid. And that'll make it easier to make better food choices and more consistent with a higher fat and lower carb type of diet. So thank you so much for coming on. I appreciate your time and energy and effort in doing this.
Thank you so much. Yeah, I really appreciate it.
Disclaimer. This podcast is for informational purposes only. The information provided in this podcast and related materials are meant only to educate. This information is not intended as a substitute for professional medical advice. While I am a medical doctor and many of my guests have extensive medical training and experience, nothing stated in this podcast nor materials related to this podcast, including recommended websites, texts, graphics, images, or any other materials, should be treated as a substitute for professional, medical, or psychological advice, diagnosis, or treatment. All listeners should consult with a medical professional, licensed mental health provider, or other healthcare provider if seeking medical advice, diagnosis, or treatment.
Or, put more simply,
If you need help like this guy, call your own doctor.
Thanks again for watching and or listening. If you're passionate about the subjects that I discuss on the channel, do me a favor and like, comment, subscribe, do whatever you can to make your voice heard, that these are problems that must be addressed in our society. If you have any questions, comments, or concerns, I want to hear them. Feel free to reach out on social media or email us at renegadepsych@gmail.com. And if you'd like to be a guest of the show, or you have a connection to somebody that you think would be a good guest, let us know. Thanks again for listening.